Hello, it's Melissa Sweet from Croakey, and I'll let Professor Fran Baum introduce herself.
Hi, well I'm Fran Baum and I work at the Southgate Institute for Health, Society and Equity at Flinders University, and I'm also active in the People's Health Movement.
And you've just given a very strong keynote presentation at the National Rural Health Conference. Could you please tell us a bit about what your calls to action to the delegates were?
Yeah, well I think one important one, and something that I picked up at the conference, is that if we want a strong primary healthcare sector in Australia, and particularly in rural Australia, then we need a publicly funded program of comprehensive primary healthcare, which will set up community health centres with a clear, separate, good funding stream for Aboriginal community controlled organisations, because I think they've developed the model better than anywhere else in Australia, and mainstream Australia could learn a lot from the Aboriginal community controlled model, and it really does need to be very well funded. It certainly is already being evaluated, and it just shows itself as a really good way to work with people and improve their health across the life course, from early childhood right through to older people. So that's number one around primary health care. And I think we learnt a lot at the conference from Sir Harry Burns from Scotland, when he talked about the importance of listening to frontline workers. And that's what comprehensive primary health care enables you to do. You give the power to the frontline workers and the community to determine what their top needs are. So there's not a whole lot of performance indicators, there's not a lot of interference from public servants other than to check that the money's being spent well, and of course, to provide good funding frameworks that concentrate on holistic funding, not lots of little streams that people have got multiple accountabilities. So that was really good. I think the other thing that there was a lot of support for was that we need to invest more in prevention, and if we're going to do that, we need to work out what the blocks to doing that are. And for me, and there seemed to be a lot of support from the conference, that we need to measure what we're preventing. At the moment, for instance, if you have a car accident, that's good for GDP, because you've got ambulances, you've got rehabilitation, there's a whole lot of services that are provided. But we don't value it if we have great road accident prevention and we prevent a whole lot of accidents. So how do we value those? How do we put an economic cost on those? If we stop someone going into prison, it saves us a whole heap of money, but we never count that. So if crime prevention works, we're not able to count that. So there's a lot of overlaps between other sectors and health, in that we're happy to pour money into acute care services, but we're not happy to put money into prevention, which in the long term will save us a lot of money. So how do we change our national accounts so we value well-being? So I think that's a really, really important one.
And New Zealand has actually provided some leadership in that.
Yes, I think they have, and the Canadians are developing an index of well-being, and of course Bhutan has their happiness focus. So their king said he's not interested in economic growth unless it brings about happiness. And I think around the world, I think the French had a commission, the Sarkozy Commission, that looked at how you could measure well-being. So I think it's coming, and I think an incoming Australian government really needs to set up a national commission to look at how we can do that much better, because it's going to be good for everybody's health. That's really fantastic. And I think the other big thing I've got out of this Rural Health Conference is the partnerships that are developing between Aboriginal people and other people in rural areas, and the recognition that a lot of the health burden in rural areas, why it's worse, is because of Aboriginal health. But there's lots of positive things happening, and so we have heard about the Aboriginal controlled health services, and perhaps importantly we've heard about the Uluru Statement, and many people have said that needs to be thoroughly, not just endorsed as in rubber stamp, but it needs to be embraced in the hearts of other Australians. And it seems to me that despite all the history of dispossession, despite the horrible history of colonialism and the racism that's come with it, our Aboriginal colleagues have said, we've got together, and here we're offering a hand of friendship to you so that we can all move forward on a path that says, look, we're going forward. The theme of the conference here is better together, and what better way of putting that into practice than a full embracing of that Uluru Statement and what it says. And what it says is that this isn't about a legal agreement, this is about the feeling from the heart between people, that we're people living on this land that was owned for and managed and cared for in a beautiful way for many, many, many millennia. But now we're in a situation where it is degraded, where there are many problems, but this is offering us a way towards reconciliation. And I think while that's dealing between the those of us who represent the colonial power and Indigenous people, it still has lots of echoes for what happened in Christchurch, because it's about embracing people who come to this land now with a different religion, different ideas about how they live their lives, but nonetheless wanting to be healthy, wanting to have fulfilling lives. So I think we're at a really important moment in Australia. You know, are we going to embrace difference? Are we going to recognise the richness of our community? Or are we going to go down a path that's divisive, that's racist, that actually is not going to be good for anybody? So for me, this conference seemed to really embrace the path that's going towards that reconciliation, taking on the Uluru Statement and saying, let's walk forward together.
Thanks so much, Fran. Is there anything else you would like to add?
No, I think the only other thing to say is what a great job Croakey's doing at covering the conference. It's really good. It's really good to have this embedded journalism, and we're trying to work out a relationship with Croakey where we can do that more in our research. So I think it's fantastic we've got socially progressive journalism in Australia. So thanks, Melissa.
Thank you very much.